Okay, so hello and welcome everyone to this, our second Care Coordinator Education Forum. So we've got a very exciting agenda lined up today where we've got Hazel from Ardens who will be delivering a webinar specifically for the Care Coordinator role. And this is an all-time first, so it's something we're very proud to share with you. Please do take advantage. This is going to be an open forum for you to ask questions. So if you'd like to put your questions in the chat or, feel free to actually ask the question because you can have your mic open as well. That's not a problem. So I'm just going to go through some housekeeping rules and then I'll hand over to Hazel. So please do introduce yourself in the chat and do let us know which surgery or PCN you are from. So thank you to those that have already done so. If you want to keep yourselves on mute for a while, and then obviously if you've got any questions, then we'll let you have the opportunity to talk. That's not a problem. Put your questions in the chat also. So the sessions will be recorded and be shared with you. And then please do kindly participate in the Menti poll. So that will be once Hazel has actually completed the presentation, then we'll have a Menti poll at the end just for some feedback and evaluation. So that'll be really useful. Please also do know that this is a safe space and it's a support session for care coordinators. So whatever is discussed in the forum will stay in the forum. So obviously the agenda today, we've got our welcome and introduction, and then from 12:15 to 1 p.m. Hazel will be doing the webinar. We'll be discussing coding, templates, searches, etc. So it's an open forum, so please do ask your questions, and then we'll have an evaluation with our Menti poll and then hopefully discuss future sessions also. So I'm going to now hand over to Hazel. So thank you.
Thanks very much for that introduction. So, as she said, my name's Hazel. I am one of the product specialists working for Ardens. Thank you for inviting me. This is really exciting for us because the care coordinator role is becoming more and more widespread. But the problem for us is it is so varied. We have done a few sessions with care coordinators previously. Generally, they've not been on their own. They've normally been bulked in with social prescribers and health and wellbeing coaches. So although I'm going to start off with a generic overview of the Ardens resources, hopefully some of the ones that you're going to find useful. Once I've gone through all of the basic stuff, I really do want feedback from you, and we'll then move towards looking at things that are going to be helpful in your job role. I did a session the other day and I had 6 people. They all did slightly different things. You know, one looked after cancer patients, one looked after patients in residential homes, and then a couple of them just did tasks that their practice set them, had nothing to do with patient-facing services. So it's really quite hard. So let me share my screen with you and we will get started. I'm just going to do a quick little presentation before we get going, just so that you know who we are and where we come from. Quite frequently, people don't actually know who we are. You know, they hear the name Ardens and they think, oh yeah, they're somebody that provide us with some templates. So just so that you've got a little bit of background, we are a clinician-led organisation. So our directors, they are GPs. We've been around for 10 years now. We started off back in 2013 with just 2 GPs trying to help their local practices, mainly ensuring they were coding correctly for QoF. So as you can see, in that 10 years, we've gone from a couple of practices to over 6,000 practices spread right the way across the country using our resources. We do provide resources for System 1 and EMIS. So if you're working in practices who have both clinical systems, then we do have resources in System 1. This is purely going to be EMIS Web though. So what are we doing? Why are we doing what we're doing? I think probably one of our main aims is we're trying to help increase the consistency and the accuracy of data that's being put into patients' records. Therefore, increasing patient care, making sure those patients are getting the care that they deserve. If somebody isn't recording the data correctly within the clinical system, then searches that other people will be running won't be pulling out that appropriate data. But it's also to do with income for practices. You know, they get paid for QoF. If data isn't being recorded correctly within the clinical system, then they're not going to get paid for it. But we also appreciate how busy GP practices are. So we want to try and help streamline processes for them, help save on time, and generally make practices become a little bit more efficient, and also help increase awareness around clinical safety. So that's what we're about. What do we provide? We provide lots of different resources that are installed into the EMIS web system. There's no separate logins or anything. They're all there in the practice's EMIS system for everyone to use. Lots and lots of clinical templates. So they make sure that practices are recording correct data for payment purposes. Any contract work is going to be in the template with the correct codes associated with it so that everybody is recording it correctly. But what else a clinical template does, it gives consistency, it gives structure, it gives guidance on your consultations. But we also know that not everybody in practice uses templates. Therefore, people will be free texting. They will be adding code randomly into patients' records. So we provide data quality alerts that are going to pop up in the middle of the screen if something's not quite right for their contract work, for their QoF work. Very similar to that, we offer clinical safety alerts. So if there is an issue with perhaps a medication that the patient's on and something else you're about to prescribe or something that you're adding to a patient's record, then you're going to get an alert that will notify you of that. We also provide practices with documents, so lots and lots of standard letters, recall letters, advice letters, consent forms, a comprehensive suite of searches and reports, pulling data out for contract work, but also best practice information. Quite a few different types of recall systems. So we've got a long-term condition recall system aimed at your QoF patients. So ensuring that those patients with QoF conditions are coming in annually for their reviews. And what our system does, it pulls everything into one contact for the patient. So if a patient's got multiple conditions, instead of sending out 4 or 5 different text letters throughout the year, this captures them in one invite to say your annual review is due. We've also got a diary recall system, which enables staff to add a date into the patient's diary in the future for ad hoc things that they might want needing to be done. Maybe someone's had a blood pressure reading that's slightly high and you want them to come back in 6 weeks' time to have it checked again. You can add a diary date to that. Always make sure whatever practice you are working in, if you're going to add any diary dates or anything to do with the recall systems, that you ensure that they are using the Ardens recall systems, because there's no point in you adding data if they're not actually going to do anything about it. And because you are southwest London, southeast London, you're southwest London.
Yeah, that's correct. Yeah, southwest.
You're on our Pro package. So we also provide locally commissioned services. So for your ICB, for areas where they get an additional payment for doing specific work, then all of our templates will make sure that they have the correct coding in the records for that. So that's everything that we provide for you. What I'm going to do now is I'm going to jump into EMIS. And I'm going to start by looking at some of the templates. I'm going to start off with the care coordinator template. I just want to make sure everyone knows how to find it and an overview of all the other templates that are available for you. Because as I said, your jobs are so random. It's not necessarily just going to be the care coordinator template that you will be using. I am going to be jumping between 2 different EMIS systems because we have a training site and we have a development site, and neither of them have everything I need on them. So sorry about that. And it is all test data. If you looked at any records, you probably realise that. So no real patient data is going to be viewed on this session. So consultations. If you are having face-to-face appointments, if you're having telephone appointments, then when you're recording that data into the EMIS system, you should be letting the system know what that is. Is it a face-to-face? Is it a telephone consultation? Am I doing a home visit? So you can do that when you're running a template. So from my consultation, the first thing I'm going to do, I'm going to go to the left-hand corner to the add button, and I'm going to open a consultation. There's various ways of finding templates, and I'm going to go through them all so that you're all aware. You've probably all got your little way of finding it, but if there's another way and you think, well, actually, I prefer to do it that way. Okay, consultation properties box. A lot of people just click OK so that it closes. But it can be annoying if this box is popping up every time you open a consultation. It's an extra click for you, which isn't necessary. This consultation properties box, it holds what practice you are at, who the consultant is, and it holds what consultation type it is. Now, usually it will default to a GP surgery consultation type, and that is a face-to-face appointment. So if you've got a clinic where you're seeing people face-to-face, then that's what you should be using. But if you're doing a telephone consultation, then you can need to change it. This drop down is configurable by your practices. So depending what practice you are will depend on what options you get in here. I think you all get GP surgery, admin note, home visit, telephone consultation. So it could well change. But if you've got a morning clinic, you're going to be seeing patients for the whole of the morning face to face. You don't want this box to be popping up every single time you open a consultation. So if you click this box that says store as default, it means that this box won't pop up again until you log out. So if I click on OK, I will show you how to change it later on. I've got my open consultation and we want to go and see what templates are available. Up on the ribbon, you've got the run template option. And when you select it, it opens up your template picker screen. This is user specific, so every one of you is going to see something different inside here. On the left-hand side is your recently used list. Now, this list builds up very, very quickly. And there may be things in there that you've looked at that you're never going to use again. You can take it out of the list. It is just a case of selecting it, right-click and select remove. You know that it's an Ardens template because all of our templates will say Ardens in brackets. So you're going to have templates created by the practice. You're going to have EMIS templates. You're probably going to have ICB templates. So that's how you know it's an Ardens one. We've put Ardens in brackets after all of them. So to find a template, you can type in the search box what you're looking for. If I was looking for the care coordinator, I can type it in and click on the magnifying glass. Now, because this is a test system, it runs significantly slower than practice systems. So I'm not actually going to search on too much because I don't want to hold us up. When I click on the magnifying glass, anything with that name in the title will then populate on my list on the left-hand side, and I can double click it from there to open it. But what I want to do is I want to show you the Ardens folder on the right-hand side here, because there's probably lots and lots of templates in there that you didn't realise existed. Again, in practice, it's going to look slightly different to my system. In practice, some of the practices will see an Ardens folder amongst the A's, but the majority of them won't see an Ardens folder here. What you need to do is you need to scroll right down to the bottom, and there will be right at the bottom, there'll be a folder that says shared folders. If you click on the shared folder, it will then say Ardens main. If you select that, then you'll get one that will say Ardens Live, and it will look like this. So this folder contains all of the templates and protocols that we have provided for the practices to use. Chronic disease templates. Now, I know that some of you cover QOF. So within the chronic disease template folder, there is a single template for each of your QOF conditions, which we will come back and look at a little bit later. Then you've got a consultation template folder, and this holds the majority of the templates. They're all broken down into different areas. So if you are somebody that covers frailty, perhaps, it might be that you want to open up the frailty template folder and use the frailty and over 75s review template. It might be that you cover mental health, in which case you might want to have a look in the mental health folder to see what mental health type templates are within this folder. The main folder I'm going to look at with you guys at the moment is the social folder. So moving down the screen, it is alphabetical. We've got a folder called social, and when I open that up, that's the folder that contains the care coordinator template. We've got a smoking status template. We've got a care home template. We've got a social prescribing. We've got lifestyle So worth having a look at these, see which ones are going to be useful for you. But the example I'm going to give, I'm just going to open up the care coordinator template to start with. So I can select it. Remember, if I'd clicked on the magnifying glass on the left hand side, it would have been over here and I could have double clicked, but I'm just going to double click it from my right hand side here, and that's going to open it in the patient's record. All the Ardens templates are built up on pages. So over on the left hand side, you will have different pages depending on what template you're in. Right hand side will be the content of whatever page I've got selected. Now, some of our templates, when you open them up, they have loads and loads of pages.
Thank you.
Sorry, someone got a question? No? Do you want to pop yourself on mute then if you don't have a question? That's lovely, thank you. Yes, some of these templates will have loads and loads of pages. Feedback we get, especially from GPs, is how on earth can I use that template? I've got 10 minutes, I can't go through 10 pages. The whole idea of our templates isn't that you go through it completing every single page. The idea is that we are trying to capture all information to do with that condition in this template. The pages are to be thought of like an index. You pick the page that's relevant, you complete what you want, you save the template. So nothing's going to be mandatory. There's nothing going to be in there that's stopping you from saving that template. So on the care coordinator template, we've got an admin and history page. A template is built up of tick boxes, which are going to record clinical codes. They're built up of drop-down fields for you to select different clinical codes. They're built up of free text elements. So the very top administration section, what I want to talk about is the right-hand side, blue writing. Anything that has previously been recorded on the patient's record, you will see it on the right hand side with the date and whatever code it is that has been recorded. Clicking on the two little arrows to the right hand side opens it in a more detailed view where you can see things that have been added over time. So the one I've just clicked on is a failed encounter, and as you can see, this patient's had a lot of failed encounters, and you can see each time what the question was and who asked that question. So selecting whatever is appropriate. Now, you don't have to, as I said, go through and complete everything. You pick whatever's relevant for you guys at that time. It might be that the practice that you're in says, oh, we don't use that part, we just want you to complete X, Y, and Z. So things like your encounter type, what type of encounter is it? You can select that it's been seen by a care coordinator. You can put your name of the care coordinator in here, so whatever your name is, so that's going to be added to the patient's record. Any other professionals involved with this patient. And you can pick as many as you want. So once you select one, it moves down for you to add some free text against it. And then you can add additional if you need to with your additional text. You can record that they're a frequent non-attender. So if you know that they always DNA in their appointments, it's quite useful information for the practice to be having. And what you're adding here is a clinical code. So if they want to do any searches on their frequent non-attenders, you've coded it. It means that they can extract that information out of the system. Same thing goes for frequent attender at A&E or multiple hospital admissions. So do whatever you feel is useful. You know, if your practice says, oh no, don't bother with that bit, you don't bother with it. It's completely down to you guys how you use these templates. You've got your employment and residential status section. So are they employed? Are they unemployed? Are they retired? If data's already been recorded and it hasn't changed, then there's no need for you to re-record it. We can see on the 26th of April, it was recorded that this patient was unemployed. If that's still the case, I may not decide to record it again. Their occupation, and where do they live? Then you've got the section around finances, so their ability to manage their finances. Are they on benefits? Are they having financial difficulties? Again, you can see on the right hand side the last time that that code was added, and if I click on the arrows, I would be able to see additional information there. So you can record the code and then you can record your free text underneath for whatever it is you're discussing. Bottom section, you've got your carer information. So recording whether or not they have a carer, are they a carer? If you're doing a carer assessment, recording that down there. And you've then got quite a large section of free text for you to be recording their current support networks. Now, EMIS has a limitation on the amount of text you can add within a template. It's out of our control how much it is. It's quite a lot. So I'm just going to do it till it finishes, just so that I can show you how you can then add some additional. We get feedback sometimes saying, you know, I'm writing my consultation, I've got not got enough room to write all the text in there. But it is a lot, but we've now come to the end of it. And I'll show you in a minute how you can add some more to that. Moving down, you've got your assessment page. So assessment of goals for that patient, recording the patient goals, any further information. Anywhere you see a blue writing like this is a hyperlink to an external website. It's usually going to be helpful information for you. So when I click on this one, why is it important to ask what matters to you? That is going to open the What Matters website information in here. There we go, your little video. Any of these links from those blue hyperlinks, if you want to send that on to a patient, maybe there's something in a template that you think, actually, that'd be really useful to send to Tracy. I've got her mobile number. I'm going to send it to her via a text message through EMIS. You can right click on the web address, copy it and paste that into whatever text provider service your practices are using. Information around consent. Do they give consent to share with the third party? Of course, always then being able to document who that third party is and that additional information out down there. And then you've got your care plan. Coding, is it admission of avoidance care plan, or are you just agreeing actions on your care plan? Your free text to add that in, or if it's a care plan review. Then you've got your signposting and referral page. So if you're signposting them to somebody else, maybe you're sending them to A&E, or maybe you're sending them to Mental Block, Age UK, recording all of this into the patient's records. Any details of further support, you can free text in here. Your referrals and follow-up section with, again, another big section for you to be free texting your consultation. Often the final 2 pages in our templates are not going to be relevant. The template version page just tells you, it automatically records that you're using one of our templates, and it tells you what version of the template it is. And the final page is information on how to fill in a template and links to appraisal toolkits, which probably isn't relevant for care coordinators. The only thing that is quite useful on this page is the link to our support desk. So we are creating these resources for you to use. If there's anything that you think is missing, anything you think we could be doing better, anything you think isn't working properly, please do get in touch with us so that we can remedy that and do something about it. So that's the link there to our support desk. So I've completed my consultation. I'm going to the top left-hand corner to save that template, which saves that into an open consultation. If I wanted to continue writing some free text in here, I can carry on here. Then I'm going to go to the top left-hand corner and make sure I save that consultation into the patient's records. Have I got any questions at this point? Okay. Another question we get asked quite frequently is, how do I edit my consultation? It is just a case of right click and select the edit consultation button. And the other thing to bear in mind, on the run template option up on the top here, it is now split in 2. The top half will open any template, but the bottom half will open again the template that you used in that consultation. So if you want to add something additional, clicking on that will open the template that you used during that consultation, so that you can then go and add something additional in there that maybe you forgot to add. And you can save your consultation again, save the template and save the consultation. So that was the care coordinator template. What's your feedback on it? Do any of you use it? Do you think it's useful? Do you think there's things that are missing? How do you think that could be made better? Ask the question one at a time. Okay, does anybody use it? I'm not getting any answers.
Hello, hi.
Oh. Hi, thanks, Verena.
Hello. I was just going to say, no, I don't use it, but I do know about it, and it's only because I use other templates and like the hypertension annual review template,
yep.
To capture all the information I need, and so I almost feel like I'm duplicating some of the work if I was to then open up another template, and so then I don't. My name is already on the system, so it captures my name because I'm putting the consultation on. So yeah, so I tend, but I like it. I like that we could potentially, if we're on the phone to a patient and we need to signpost them somewhere, that we could capture that information in that template. I do free type that into a consultation, just on comments, spoken to patient, and yeah.
Okay. Okay. Moving on from that, free texting is all well and good, but if it's something that potentially a practice might want to search on, then adding a code means that that can be searched on. But I get the point of you certainly don't want to go into one template and out again into another template. That really isn't the idea. I think probably the care coordinator template is very much a generic, basic consultation with the patient where you're not doing anything specific. If you're looking at hypertension template, you're obviously doing something around hypertension, and I would totally agree with you, that's the template you should be using. So
okay, good.
Okay, any feedback from anybody else? Okay, let's talk about chronic diseases then. So Rowena's already told me that she uses the hypertension template. Just out of interest, Rowena, have you used it recently? We've done a really big update on it, and we are waiting for feedback from practices. I am going to have to change EMIS systems to show it to you.
Yes, I mean, I use it all the time. I've used it just a couple of minutes ago before this meeting.
Okay, I have to show it from the back end of this system because they're working on it. But what we've done with this template is, which is what we're about to do with all of our templates, we're doing it one by one because we want feedback from practice first. We're slimming down a lot of our templates, taking out some things that perhaps our clinicians feel maybe is a little bit too much in there. And we're also trying to make them smart working templates so that you get green ticks and red crosses if an element for contract has or hasn't been completed.
Sorry, I just want to add that I use the multi-morbidity annual review, and then I select the hypertension because that's my cohort of patients that I look after. So yeah, so I use the multi-morbidity, sorry, not the hypertension.
Okay, no, that's fine. That's fine. I'm going to come on to the multi-morbidity in a minute. So the multi-morbidity one hasn't been updated, so you won't have noticed a change. But the hypertension one, if I do a test run on it, because they're working on it, so I can't actually show you it in reality. But when you open it in a patient's records, all of our chronic disease templates start off with a national contract page or a QOF page. This is purely the coding that is needed for your contract work. Now, what happens now is, if the indicator has been completed, there will be a green tick to say it's been done. If the indicator hasn't been completed, I haven't got anything here. If the indicator hasn't been completed, there will be a red cross to say it hasn't been done and you need to be doing something. Okay, so this is really, really new. We've done it for our drug monitoring, hypertension and cancer templates at the moment, but watch this space, they are all coming. But it just means on that national contract page, it clearly gives you a very quick overview. This has all been done. I don't need to worry about it as far as contract is concerned. So next one I wanted to talk about was the multi-morbidity template. Okay, I showed you how to find our template from an open consultation. So you add your consultation first. You can also click on the drop down to the green add button over on the left hand side and select data using template. It takes you to exactly the same place. It's just a different way of doing things. You can type in the search box for multi for our multi-morbidity template, and you will get back here a multi-morbidity initial consultation template. This is generally aimed at HCAs, your phlebotomists, your people who are doing that initial blood test, height and weight, BP. And then you get the main annual review template that holds everything to do with their conditions. Now, these templates are smart working templates. So what that means is when you open it, you will only see the condition pages relevant to this patient. It is very much a QOF only template. The condition pages do not have all of the best practice information. They don't have the links to helpful websites. It really is a bulk standard QOF type template. Well, I think this is probably a good one for care coordinators to use because it kind of contains most of the care coordinator template information as well as QOF information. Remember I said nothing's mandatory, so you don't have to do every single page. We've got the what matters to the patient page. So again, this was on the other template in parts. What are their priorities? What issues do they want to discuss? How are their well-being? You know, do they have any walking problems? Are they had any falls? Care information. Care information is so critical to be recording on the patient's records because things like, you know, they get a free flu jab if they're coded as a carer. But it's also really quite important for CQC to see that practices are monitoring and supporting their carers within their practice. You've got a lifestyle and screening page. Now, anywhere you see red writing in our template, that will denote contract work, payment work. OK, so it will tell you what it's all about. So this is talking to you about your QOF smoking status. It tells you what you need to be doing, and all the codes in here, you know, are going to be acceptable codes for QOF. All of your QOF requirements need to be recorded every financial year. Over on the right hand side, you will see whether or not that's been recorded, and if it has, absolutely fine. If it hasn't and you're able to record it, then it will benefit the practice if you can record that data. You've got some links here to nice guidance around smoking cessation. You've also got a quit smoking leaflet that you may want to print off for the patient. Same thing goes for alcohol status. You've got your information about identification. You can record the patient's blood pressure if you're taking blood pressures. Is that something care coordinators do? Do you take BPs? Yeah. OK. There we go. Also recording if they have refused, because that is a QOF indicator. If they've said, no, I don't want it done, then the practice are not penalised if they don't achieve that target. What else have we got in here? CVD prevention, if you're referring anyone for an ECG. Recording obesity. Obesity is a quick win for practices. The QOF obesity register, they don't have to do anything with that register. They just have to hold the register. The more patients on the register, the more points they get per patient, which means the more money they get. So recording BMI wherever you possibly can is really, really useful. Just a little quick EMIS tip about height and weight. EMIS asks for it in centimetres and kgs. You don't have to convert it before you put it in. If, you know, they say to me, oh, I'm 5'5", pop in that in there. When you click away, it works it out for you. Same thing goes for weight. If the patient says I'm 10 stone 5, when you click away from it, it will convert that to kg for you. Weight management is an enhanced service, so you can see plenty of red writing here with links to your weight management specifications and the NHS Eat Well website. You can also record details around memory. Their ethnicity, again, is another one that's really important to be recording. So if there's no entry on the right-hand side, then selecting their ethnicity and capturing that for the practice will be another useful one. OK, moving down, you've got an anxiety and depression screening page, if relevant for you guys. If not, absolutely skip over it. Same thing goes for the Rockwood Frailty scale. I'm guessing it wouldn't be something that you would be recording. But Blood result page gives you all the latest blood results of the patient. You'll see them over on the right hand side in blue if they have been recorded on the patient's records. Vaccination page is information for you. When did they last have their flu, their pneumo, the shingles and their COVID jab? You can see the dates over on the right hand side. Now those pages you're going to see for every single patient. Then it gets to patient specific. So this patient has got COPD, he's got CHD, but he hasn't got asthma. So I'm not seeing the asthma page. On each of these pages are all of the QOF requirements for that condition. So it is purely QOF. There's none of the extra best practice information. It's purely QOF. It tells you in red writing what you need to do, and the coding is there for you to be recording. If you're actually doing a full review, which I'm guessing you wouldn't be, but maybe you are, and your practice is using our long-term condition recall system, this code at the top is really, really important to record that you have completed that review. I think probably it's going to be the nurses that are doing that, but I just wanted to mention it just in case. So as Marina said, she just picks the page that's relevant. So she was just picking the hypertension page, complete what you want, and you can just save it there and then. Another page that I think is probably going to be quite useful for you is the care and support planning page. So on this page, we have got your provision of proactive care code to record that into the patient's records with your free text section. You've also got the link to the proactive care frameworks. If you wanted to go and have a little read about what this is all about, the NHS long-term plan, it's in there. And you've also got links to the proactive care consultation guide. So aimed at care coordinators, really, isn't it? As to what that proactive care plan is all about. It's a guide to design to support your primary care team, so your wider team, your ARRS roles in providing these this care for your patients. So that's a really quite a good link that you may want to have a little look at. And then recording details around a care plan, recording your goals with the patient, so you're identifying those goals and you are free texting what those goals are. You've also got a section for referring for social prescribing. So if you are seeing that patient, you're also going to refer them to the social prescribing member of staff, then recording that in here is part of contract work as well. So as you can see here, red writing, this is the code that needs to be used to say that they've been referred to social prescribing. You've also got that link there to the what matters to the patient website as well. So that is your multi-morbidity template. So complete whatever's relevant, top left-hand corner, save that into your consultation. Another way of adding, actually, before I do that, let me just open that consultation up again. I said to you earlier on, we had that consultation properties box and we saved it as default for GP surgery. When you've got your consultation open, that box is stored up on the ribbon here. This is storing it as my consultation, a face-to-face GP surgery type consultation. If I want to change it, so maybe I'm seeing patients, but someone's not turned up, so I'm quickly doing a telephone consultation to someone, I can click on the little arrow to the right-hand side and change it just as a one-off. It's going to be a one-off telephone consultation, and then the next one will carry on as whatever I saved it as default. But if I want to change the whole default, you know, I've done 5 face-to-faces, I'm done with that. I now want to do the rest as telephones, click the big major bit of the box, and that brings this back up and you can change it again. So that was 2 different ways of finding a template. The other way is adding a template launcher to your F12 screen. So quite a lot of people like the F12. The F12 is a button on your keyboard, so you just press it. 1 minute, I need my other EMIS system. Let's do that again. Okay, F12 on my keyboard. And what we have is a ARRS template launcher. So you will all need to add this to your F12 key individually. You only need to add it once. So what you do is you press F12 on your keyboard. You would find an empty letter right click and select add. And in the search box, if you type in ARRS, click on the magnifying glass and it's going to come up with the ARRS template launcher. Click on OK. That will add it to your list, so it will always be there. And what you can do here is you double click it and you get a multiple choice question. So what template do you want to open? What's your job role? Care coordinator. Do you want to launch a job role specific? So for care coordinators, it is purely only that care coordinator template. Or do you want to launch another template? If I launch another template, it then says, OK, which one do you want? And you've got those chronic disease templates. You've got all of those different folders for you then to go and select whichever one you want from there. So if I wanted the main, I don't know, chronic disease template for asthma, I clicked on chronic diseases, I would then click on asthma and that will open the asthma template for me. So it's a different way of getting to templates. When you finish it, it says, would you like to launch another template? If you say yes, it goes back round in a circle and asks you which one do you want to launch. You can also, so that template launcher was specific to care coordinators. You can also add the multi-morbidity templates to your F12. So if that's one that you prefer to have on the F12 key, you can right click, click on add. And in the search box for this one, if you type in multi, you will find the multi-morbidity templates. I'm not going to do it because I do already have it on mine. So you'll click on the magnifying glass, you'll select it. And I have it down here, Arden's multi-morbidity template launcher. So I can double click. It says, which one do I want, the initial or the annual? And that's just going to open it up in the screen there. So you can add any template, any template folder you like to that F12 key. Any questions? Okay, I'm going to move away from templates slightly because I'm just going to move on to talking about that F12 launcher because there's a few other things that you might find useful on your F12 key. One of them is called a patient information summary launcher. And what this does is it opens a read-only template to show you important data that has been coded on a patient's records. It's a really quick way of seeing, is there a safeguarding issue? Are they deaf? Have they got a key code when I need to go and visit them? So lots and lots of different information. It will only show you whatever has been recorded. So again, you add it, you do a right click, you select add, and what you're searching for this time is patient information summary launcher. So when I double click it, I'm clicking on OK. This is just a read only. I'm going to cancel the consultation when I finish. So it has a couple of pages over on the left hand side, patient information summary. So this is looking at things like, are they deaf? Yes, the patient is coded as has difficulty hearing. They require an interpreter. View interpreter requirements. So click over on the right hand side, we'll see that they need French. They've got reasonable adjustments recorded on their records. They've got some kind of carer status recording, so the patient has a carer. View the carer details, so clicking on the arrow to the right will give you those details. The patient is coded as moderately frail. The consent page will record if they have consented to various different options, you know, consented to received text message, consent to share on the summary care record, consent to share with a third party will be detailed on here if it is recorded. So depending on what patient you've got open will depend on how much information you view in this template. The information page is just your how to get in touch with us. So I would always cancel that because it's a read only, and if you click save, it would save an empty consultation. Any questions on that one? Can you add information on this template? No, it's added from other areas within the record. So depending on what template you're in, it will be within that relevant template. It really is just a read-only template for quick information. Another F12 key that you might find useful is knowing if a patient has a blood test due. So we provide alerts for the practices that will pop up in the middle of the screen or will be displayed in the pink alert box at the bottom here. We have a blood test due analyzer. If a patient has a blood test that is due because of a certain medication they're taking, or maybe the condition that they've got, or maybe they need CVD primary prevention, or maybe there's a diary entry to say that they need a blood test. If the practice are using it, and only if the practice are using it, it will be displayed in this pink alert box where it will say blood test due. It will tell you what it is due and why. So as you can see here, this patient needs medication. They need U's and E's because of the medication they're taking. They need an HbA1c LFTs because of the long-term condition that they have. Double clicking from there opens a read-only template that again shows you what blood tests are due. Now, for you, probably the F12 is going to be more appropriate. I don't know. It will only show in the pink box if the blood test is due today. So if someone, let's say someone's got diabetes and they have an HbA1c every year, so it's due annually. They had it done in February last year. This alert isn't going to be here because it's not due until February this year. So it's not due just yet. So that alert will not be there. There is a way of manually opening this template without the need for it to be within the alert, which I'm going to show you in a minute. That's to add to your F12. But let's look at the template. So what the template does, it shows all of the blood tests that this patient ever has, linked to their medication, their conditions, their diary dates. If it is due now, there will be a triangle with an exclamation mark in. There we go. So this one is due now. These are all in alphabetical order. The ones at the top, this is due at some point, but not necessarily now. So the egg glass means it's due at some point, and it tells you why that patient has that blood test. Remember, this is a test patient. They've got everything known to man, which is why we're seeing multiple things here. So this isn't due at the moment, but the patient does have a cholesterol check needed, and it is done every 12 months because they have a mental health condition. It's done every 12 months because they're on the learning disability register. Moving down, this one here, it's saying they need an HbA1c and it is due now. And they need it because they are on this register, or it might say they need it because there's a diary date. We show you the latest result and the date that it was done, because it might be that you're seeing this patient, you have a look at their bloods and you think, actually, they're in the practice now. They've got a whole load of bloods that are due in February. Why don't I just see if the phlebotomist can take these bloods now? Let's just go down the corridor, see if they can get an appointment with them now. But it's an information template for when bloods are due. I'm going to cancel it because it will save. No, I'm not actually. If you save it, what that puts into the consultation, it shows what bloods are going to be due. So it puts that detail into the consultation. It doesn't actually request any bloods. That has to be done separately on the ICE system, but it does put in that consultation that the HbA1c is due, the LFT is due. So it adds that data to the records. As I said, this only appears in this pink alert box if it's due now, but if you want to use it, you press F12 and you can add that. She says, there we go, launch blood test due analyzer. So you, again, empty letter, right click, click on add, search for this one. And when you double click it from here, it will open that template up, irrelevant of whether or not anything is due now. It will just show you all the details as we saw just now. It kind of overlaps with our diary recall system. So previous to this blood test due analyzer, we still got it. We've got a diary recall system where clinicians can add a diary date in the future for all sorts of things, as well as blood tests. So they can add it for, maybe they want someone to have a chest x-ray in 2 years' time. Maybe they want them to come in for another blood pressure in 6 months' time. So it's not just bloods on the diary recall system. So if there is a blood test due from the diary recall system, you will have a diary entry due alert. Now, for practices that are using both, there is an alternative alert to this diary due one, which includes everything except blood tests, because they don't want to duplicate. You know, you don't want to see the blood due analyzer one that says they need their FBCs done, and then a diary entry one as well to say they need an FBC. So they can choose which protocol they see down in this pink alert box. That blood test due analyzer is installed into practices inactive. It is down to the practice to decide whether or not they are going to use it. So you need to check with your practice whether or not they're using it. I can just see Maria's put in the comments that she can't find the template. That will be why, Maria. The practice that you are logged into obviously are not using it, and therefore they haven't switched it on. Okay. If you want to talk to the practice about it, it might be that they're not aware of it. They need to activate it if they're going to use it. And to activate it, they need to go into configuration, into resource publisher, and there is a folder that says, for them, they need to access via the shared folder. So they go into the shared folder, then they go into the Ardens folder, and in there is a folder that says blood test due analyzer. All of these will be inactive. So they need to come to the folder, they need to right click, status, and activate it. We do have support articles showing how to do this, and if the practices want any help, then tell them to get in touch with us and we can support them in how to activate that. I'm conscious that I've been talking for an awful long time, so I'm going to stop. That's all I wanted to cover with regards to clinical templates and the F12 protocol, and just to make you aware that there are quite a few alerts down in the pink box that we've provided. This is where EMIS put alerts as well, so we haven't duplicated anything that EMIS have done. You know that it's an Ardens alert. When you hover right at the bottom of the additional information bit, it says alert provided by, and there's a link to our website. Okay, some other alerts that you may well find useful are the carer alerts. I thought this patient had a carer alert. So many of my test patients. There we go. So this patient is a carer. You can double click on it and it will open up the carer template. So let's stop and see whether anyone's got any comments, any templates you want to ask, have we got? Anything that you want specifically to see whether we've got any resources for your specific job role? Silence.
Hazel, sorry, can I just ask? I know there might be some care coordinators out there that are specific to the cancer role. Is it possible just to quickly touch on any of the cancer templates?
Yep, absolutely.
Thank you.
The cancer template is one that we have recently updated as well to be one of these smart working templates. So you find it the same way you find any of the other templates. Let's go via the add button, data using template. I can type cancer into the search box. If it's already in your recently used list, you can double click it from there. I've got it here, cancer. It is a new one, but it would be in the chronic disease folder. This is the development site, which is why I don't have a lot in here. They're working on things, but this would hold all of your chronic disease templates and you can double click it from there. So let's open up the cancer template. EMIS has decided to not respond. Gonna let me do it from there. Not quite sure what I'm going to get on this patient. Okay, this patient's no good for me. Okay, so on the very first page, as I said, we've updated this. This is one of the ones that is going to do red crosses and green ticks. this is telling me this patient is not on the cancer register. Okay, because there are so many cancer codes, we can't include all of the diagnosis codes within the cancer template. But what we have provided is we have provided alerts if you are entering a code that is not a QOF recognised cancer code. Most of the cancer codes start with malignant neoplasm, but I'm guessing it wouldn't be you guys that are actually adding the diagnosis code, but it is worth showing you in a minute what those alerts look like, just so that if you see one, you know to speak to somebody. So this page is purely QOF. So it will have on this page all of the things needed for QOF, and it will have green ticks or red crosses if it has or hasn't been done. Then you've got your additional pages. So you've got your administration page, recording things around emergency contact details, mental capacity, consent to share, and the performance status. The actual review pages are separated into 2 different pages. So that 3-month review, where you have you're just providing them with that information, they've recently been diagnosed, and for QOF they have to have this review within 3 months of diagnosis. This is the code that must be used to indicate that that review has taken place. And then you've got the rest of the page to be recording that review that you may be doing with the patient. Plenty of blue hyperlinks to external websites. So there you've got the Macmillan website for support that you may want to give to the patient. You've got the section around financial and social, so recording whether or not they need an SR1 form. You've got a lifestyle section for recording any holistic needs assessments that you're doing, and resuscitation status. The cancer care review page is mainly a more in-depth review, and this is the 12-month review. So this code is the one that is needed for that 12-month review with the cancer patient. Quite a bit of extra stuff in here. So the stage of the cancer journey, recording the diagnosis and the care discussion. So remember, it's coding everything in here, and then you're free texting your consultation. The resources page on all of our templates is links to additional websites linked to that condition. So if we were on the hypertension template, there will be a resources page. There will be links for information for you to give your patient. There will be links for information for you guys as a healthcare professional. Save it into the patient's record. Let me just quickly show you what one of those alerts will look like. If I was going to add directly into the patient's record a cancer code that is not a I've got a mental block now, that's not a QOF code. No, it's not going to work in my system. What you will get in the middle of the screen, you'll get a red box that will say this is not a QOF diagnosis code. Most of these start with malignant neoplasm. If you are recording cancer results, so if you're responsible for recording things like breast screening results or cervical screening results, then we do also have a cancer screening template. It's a results one, so actually it's not going to open in this system, I don't think. Let's go across to this one. Oh, you will only ever get one template per condition. This is because this is a test site. So cancer screening follow-up template, it's got a page for your bowel, your breast and your cervical screening to record results, or if they've DNA'd or if they've declined. So all of the correct codes in there that you may want to be using. So that was cancer. Somebody's just asked about safety netting. Safety netting with regards to what? Cancer safety netting or safeguarding? We've got 2 really good okay, cancer safety netting. So that the code was in the cancer template. So on the first page of the template, you'll have the cancer safety netting code within the template. Really good safeguarding template. So if you are worried about anything to do with safeguarding, we've got a child, an adult and a domestic violence safeguarding templates. I am quite conscious of time now. Fozia, is there anything else you want me to talk about with regards to templates?
I think we're good. I mean, that's extensive amount of information there. We appreciate it. I think we're good. I just have a quick question though, if nobody else
Yep.
does. Say for example, we've got a blood test results that's outside of normal limits. What's the best way to move forward in terms of, is it a diary recall to actually kind of get the patient to come back in for a blood test, or for example, blood pressure readings? What's the best way to move forward with that? What's the easiest way to move forward with that?
It needs to be practice specific. So you
Right,
need to
okay.
check what system your practices are using. If they are using our diary recall system, then definitely the diary recall template. And that is one that you can add to your F12 key. So it's called diary recall. So if I double click that, that's helpful. It's not active. Let me quickly add it again. There we go. So you want the launch diary recall template protocol. When you double click it, it opens the diary recall template. And what the diary recall template does, it provides, the first page is an overview. So it shows you what is already in the patient's diary. And then you've got the relevant pages for adding those diary dates for something that needs to be done in the future. So lots of things are included in here. Your injections are included. Your BMI, blood pressure. So these are probably the things that are going to be that you may want to add in. So the patient's had a high blood pressure. You want them to come back in 6 weeks' time. You tick the box to say you want a diary date. You go to the calendar. You can use the EMIS quick links. So D for days, W for weeks, M for months, Y for years. I'm going to say 6W for 6 weeks' time. And that is going to put that date into the patient's diary. Okay. There's the blood page. So if they have had a out of range blood test and you want it repeated, then again, you can add a diary date for that specific blood test. But you need to check that your practice are using this, because there's absolutely no point in you doing this if nobody's doing anything about it. Okay, so you add the date to the patient's records and you save that, and that will populate it in the consultation, but it was also populate it within the patient's diary. So in the patient's diary, there we go. The blood pressure is needed at the end of February. And for the practices, what we have within population reporting, which is where the searches sit, we have a diary recall search folder where they can go and have a look and see things that are needed in the future. Did that answer your question, Fozia?
Yeah, no, that's perfect. Thank you so much.
Okay. Shall I talk a little bit about searches, or do you think I've given everybody enough information now? Do you think you're on information overload already?
I'm going to say, oh yeah, we've got someone that's wanting the searches.
Okay. And remember, if you are on information overload, that was a lot to take in, so that's absolutely fine. But remember, this is being recorded. So if you want to go back and, if you've had enough now, you can go back and look at this last section, once you've had a cup of coffee and 3 bars of chocolate. Okay, so searches enable the practices to extract information out of patients' records. It can only extract coded data, which is why it is so important that you code things, and why it is so important that the coding is consistent, which is why templates are important, because the coding has already been put into the templates. And if you're using an Ardens template, you know that the codes in there are going to be respective of the Ardens searches. So within population reporting, your practice will have an Ardens search folder, and in here, no word of a lie, there are hundreds and hundreds and hundreds of searches. Some of the ones I think you might find useful so before I go on, the numbers on the left-hand side will always stay the same, and we keep all the different categories together. So as you can see, all of these ones, the 1.1s, they are reviews. The 1.3s are administration. The 2s are prescribing. The 3s are vaccinations. The 4s are different types of conditions. And the 5s are your contract work. So a few searches. Please pop in the chat if there's anything specific you want to look at in here. I'm going to pick some out that I think might be useful. In the appointments folder, When you click on the little arrow to the left hand side, that tells you there's other things inside it. And what we've got in here is we've got frequent attender. You might be interested in your patients with who are coming to the practice a lot. They might be patients that you need to be seeing or maybe need to be referring to the social prescriber. If you double click the folder, it opens up the content of that folder. A search is indicated with a magnifying glass and you will get a list of patients. A report is indicated with a page icon and you can view more detailed information on that one. Rowena, I have seen your message. I will come to that in a minute. So the frequent attender might be a useful one. The other one that I think is probably going to be useful amongst the admin folder is the carers folder. So really, really important that you are taking care of the practices carers. They are given the support that they need. We've broken it down into all carers and then your different ages. Your recently coded carers, your new registered carers, you know, they've not had any support. These might be patients that do need support. You can run a search folder in one, so the whole folder. I can right click and select run and I click on yes. That will run everything inside that folder. However, if there is a lot in that folder, it will be very slow. So if I only wanted to run one search within the folder, I would open the folder up and I would do it from here, right click, and I would select run and I would say yes. Once you've run it, the results, it will say queued and then you will get the results here. The number is telling you the number of patients. For a search to see that number of patients, you go down to the bottom half of the screen and look at population included, and that will give you the list of patients. A report, there's different types of reports. Most of the reports will be like this. This gives you more information. And to view the results of that report, you go up to the ribbon and you click view results. It will give you information relevant to that search. So often it will give you their EMIS number. Quite often it will give you their contact details, their phone number, and then whatever is relevant for that search. So this is looking at their latest carer codes. Some reports are like this. This is an aggregate report. It's just going to give you numbers. So if I looked at this, this is looking at the type of carers. And when you view results of that, it's just showing me it will be different types of carers. So I've only got one in the results, so it's only one code. So that is your carers. Let me go back to what Rowena wanted. LTC reviews, trying to understand between this. Don't look at the denominator searches, Rowena. The denominator searches are searches that we have built to build our searches on. They are very, very complicated and confusing. Okay, I would use the mop-up searches. If you are ever wanting to know why a patient is in the results of a search. So here we've got all of these 34 patients need an invitation. The most commonly asked question we get is, but they've had everything done, why are they there? They have to be coded for every single review. So if they've got asthma and hypertension, they have to have both of those reviews coded as done. Otherwise, they will still come back in the results because they have something outstanding. But if you click up on the ribbon, can you see where it says full hierarchy? At the moment, it defaults to folder hierarchy. If I click on full, it then opens up all of the searches that is based on. And this is the only reason I would be going into those denominators. These are the denominator type searches. But what I would be doing, this will then tell you which condition is this patient being recalled for. So if, for example, let's do my population included, Stephen Carpenter, they say to me, but this patient's had all these reviews. Why is he still coming back? I would go up to the search that says at least one annual review missing. I would do check patient up on the ribbon. I've forgotten what his name was. What was it? Carpenter. And I would search for him there. I'm hoping I've only got one Carpenter. Oh God, what was his name? Stephen. Yes, Stephen Carpenter. And that will tell me why he's in the results of that search. So there's no matches for asthma, no matches for AF, What we're looking for is a match. There we go, match. He's still outstanding his hypertension review. So that is probably one of the only reasons, and that is part of the denominators, but for you, I'd say that's probably the only place you should be going. Yeah, or come to us on support if you've got a query. Okay, any other searches? What other searches? Conditions. So if anyone is responsible for keeping tabs on frail patients, then within the conditions group of folders, we have different types of conditions. So your cardiovascular conditions, your diabetic conditions, your respiratory conditions, your cancer conditions. If I open up the frailty folder, we've got some frailty management searches. So management, looking at all of your patients who are coded with severe frailty. The title of the search we've tried to make really self-explanatory as to what the search is looking for. So if we looked at this one, for example, severe frailty, so they are coded as severely frail, but they don't have an annual falls assessment done. And all of the patients coming in the results of that search will be in the population included, and they're the patients that may need something done. So that was your frailty one. For people who are looking after cancer patients, we have a cancer folder. We have recently updated this. So if you are used to using this folder, it has changed quite significantly. All of these conditions folders have the same sort of things: activities, alerts. Activity is just showing you what has happened over the last month or the last 6 months. Alerts, something is needing doing. Screening, who's eligible for breast, bowel and cervical screening. We are not giving you recall searches for this because it is not down to the practices to be recalling them. That should be done centrally, but what we are showing them is an overview of what's happening. If any of you are responsible for learning disabilities, then we do have the learning disability folder, very similar to the cancer and the frailty folder, with those different types of searches in there. What else? If anyone's responsible for QOF, then in our QOF miscellaneous folder, we have all sorts of data quality searches in here. There has been a real big issue lately with new coding for LD and COPD. So we are giving you some data quality searches. Anywhere you see data quality, it means the practice has done some work, but the coding is not quite right. Anyone who deals with safeguarding, we have a safeguarding folder. So really, really comprehensive suite of safeguarding searches broken down into your adults, your child's and your domestic violence. Each of them have the same type of searches: your activity, so what's happened, alerts, things that may need to be looked at, case finders. There is something in their records that indicates they have a safeguarding issue, but it's not coded on the patient's records. And then your registers, so what type of safeguarding issue is that on the patient's records. Mental health, we've got the SMI mental health folder, so looking at those mental health checks that need to be done, broken down in work done and work to do. So your work done folder is your achievements. Work to do, these will be the patients that haven't had those core 6 checks done. Also, what else was I going to say? Network DES. Anyone responsible for network DES and learning disabilities, your network DES folder will show you your done, so your achievement of those learning disability patients who've had the health checks done, or those patients who are outstanding and still need their health check and action plan done. I think that's enough about searches. If anyone does run searches or wants to know any more about our searches, we can do specific searches training sessions. So just highlighting, you know, how our searches work, what searches we've got available. So please do get back in touch with us if that's something that is of interest to you. Or if you've got any specific queries like Rowena had about her one question, then please do get in touch with us on our support email, because we're there all day, every day, well, Monday to Friday, ready to answer your queries of specifics. And it might be that we do a quick 5-minute Teams call with you to go through something, or it might be that a quick email will suffice in answering the question of whatever it is you are looking for.
Hazel, yeah, I think
yes.
we might suggest the same as well. So we might actually put together like a feedback session for yourself, and then
Brilliant.
if there is any kind of specific questions with regards to searches or even the templates, we might need to call you back.
Absolutely fine, absolutely fine. Yep, yep,
Yeah,
whatever works for you.
Okay, brilliant. That's fantastic. I am quite conscious of the time.
Yeah,
We've got
sorry.
about 10 minutes. No, it's been an absolutely fantastic session. Seriously, it's been jam-packed full of really useful information. I hope everyone else agrees with that. What I'm going to suggest then is that we just move on to our Menti poll just to get some evaluation. But Hazel, I think the likelihood is that we'll be calling you back in because I think we might have more specifics with searches. I think we went into the templates quite extensively, and I think that was fantastic because there's a lot of stuff there that I didn't even know. I've been in post now for over a year, so it's been really quite useful. But with searches, if anyone's got any specifics that they want to know, we'll try and pull it all together, and then we'll bring Hazel back in, perhaps for the next forum. If not, then the next one after that, if that's okay.
Okay.
So
I've just
go
put in
ahead.
the chat, I've just put our website, which is here, just to
Brilliant.
show you we've got a lot of support articles. So if you clicked on support EMIS, look, don't look at that, that's mine. You will see it like that. Lots and lots of support articles in there. So there is a whole ream of stuff about our searches in there. If what you want isn't on the support centre, then get in touch with us, and I've put our support email in the chat for you.
Fantastic. I'll liaise with you as well, Hazel. That's not a problem.
Brilliant.
Thank you.
Well, thank you all for your time, and I will. Do you need me, or shall I go?
No, that's absolutely fine. You can hang fire if you wish, but no, that's brilliant. Thank you so very much.
Thank you.
Brilliant session. Thank you so much.
I will speak to you all again sometime, I hope. Take care.
Take care. Thank you, Hazel.
Bye.
Thanks. Thank you. I'm going to hand over, guys, to